Good morning. Buenos días.
Buenos días.
Anyway, so I'm happy to be here back in California. I was raised in California, but in, let's say, Northern California. But it's always nice to come back, even though there's a drought, right? I wish we could transport some of the water from the eastern part of the world, country, back to California. So let me just get going here. So this is what my topic is: the emergence of cultural competence and connectivity to health literacy / language access services. Okay. So these are the themes that I'm going to try to cover the next 10 minutes or so. Talk about, give you a quick definition of cultural competency, some key concepts of cultural competency, and trends, drivers that facilitate the integration of cultural competence, health literacy, and language access services. Talk about demographics, health disparities, costs, which has been brought up already. Some legislative authorities, accreditation bodies, and literature. Then hopefully, if I have time, just summarize it real quick. So the definition of cultural competence, I'm going to read it, but I think there's really not a universal definition in terms of cultural competence. But I think some of the key concepts or elements are, the provision of effective, equitable, and understandable and respectful quality care and services that are responsive to the diverse cultural health beliefs of patients and that recognize, their practices, their preferred languages, address health literacy, and other communication needs of that particular patient. So if you think about it from, let's say, the report, what was it on the CHASM? I forgot the name of the report. But this is all patient-centered care, right? But they didn't put it in terms of cultural competency. But what are some of the key concepts I think that need to be addressed by healthcare practitioners? I think we need to start looking at it from the lens of the patient. How they view their particular illness, their particular health condition. Is it because some view that it's if they get cancer, if they get diabetes, you name it, it's because it's a punishment of God, okay? Or let's say a little baby, for example, babies that are born in Mexico, sometimes they call it the evil eye, right? Because somebody, a relative or another person gave that baby a look that caused that baby to have some kind of health condition because of that particular, somebody made that evil eye to that patient. The issue of fatalism. I remember when I was in college, I would come home to visit my family, and I would hang out with some buddies, and they would tell me, so-and-so's dad died, right? And I would go home to my dad and tell him, so-and-so died, and he would just say, well, it was his time in Spanish, right? It was his turn. It was like just, that's the way in terms of the life cycle. It wasn't, well, he wasn't sad. He said, mijo, that's life. Así es la vida, It just, things happen for a reason, and it was that person's time to die. Addressing the communication needs of patients. Obviously, if you don't speak English in this country, you're going to have a difficult time communicating with your practitioner. Additionally, if your educational levels are not the level of, let's say, 6th grade or 8th grade, whatever, health literacy comes into play. Not only that, but even if you're educated, sometimes, there's, the issue of questioning authorities, especially from, let's say, my experience. I was raised that you don't question three figures, right? You don't question the doctor, you don't question a priest, you don't question a teacher. So, how do you deal with those kind of cultural kind of perspectives that you're raised from, to break down those communication barriers? I think, the concepts of providing culturally competent care fall into the realm of patient-centered care, equitable care, okay? And I think workforce, I think is really key as well. Developing a workforce that is inclusive of the demographics of this country. If you look at this particular chart, and you can see the population in terms of the growth of the various minority groups. Let's say by 2050, 48% of the U.S. population is going to be composed of the four racial and ethnic minority groups. And even before 2050, I think we're going to increase the numbers. So in terms of markets, I think there's a lot of providers, especially CMOs, that are looking at these population trends. I call them game changers in terms of what kind of strategies are they going to use to reach these particular populations, and obviously using cultural competency kind of approaches to address these populations. Disparities in America, I think, is another game changer. Why are we doing this kind of work? Why are we developing cultural competency kind of programs, initiatives, or health literacy kind of initiatives? Because we want to deal with health disparities. If you look at diabetes, we have close to 29 million Americans who have diabetes. 50% of those individuals come from various minority groups. So that's 50%. And you look at the healthcare costs, that's tremendous, tremendous. Obesity is another kind of epidemic. Young folks, about 42.6% of children are considered to be obese. The majority are Latinos and blacks who have the highest rates of obesity. And that's due to what? Poverty, lifestyles, and environmental factors. Drivers of healthcare costs. It goes back to health equities. Premature deaths in the U.S. cost the U.S. about $1.24 trillion. Okay. And if you eliminate health disparities, it would reduce the direct medical care expenditures by let's say $300 billion. This was by 2003, 2006. This was a study done by Levis out of Johns Hopkins. Limited English proficient populations, I think Wilma's going to talk about this, but the growth of language minority populations is not decreasing, it's even growing. All right. And we have close to 55 million individuals that speak another language other than English at home. My kids, I have 3 kids, they speak they speak all Spanish and one speaks Portuguese as well. So what are some of the authorities in terms of that have pushed the whole cultural competency and health literacy agenda as well? The class standards that were issued in 2003, then reissued in 2013. In 2002 there were 14 standards, and in 2013 there were 15 standards, basically providing pathways for the delivery of culturally competent care to diverse populations. Then we have the HHS Office of Civil Rights, their guidance in reference to individuals, LEP individuals. And the first guidance was issued in 2000, the second one was issued in 2003. And then we have the Affordable Care Act that Dennis talked about. There's about maybe 19 provisions that address cultural competency care and health literacy. There's about 5 states that have already passed legislation mandating some form of cultural competency requirements into health care delivery system. And this is just a map of some of the states that have passed legislation. We have a number of publications citing cultural competency care, and it has even grown more. I mean, this chart needs to be updated, but if you pick up any kind of report dealing with health equities, you'll find the reference to cultural competency kind of trends and progress. And I don't have time to summarize it, but you can read this. Thank you.